November is Diabetes Awareness Month. New studies that explore the link between COVID and diabetes suggest a COVID infection may increase the risk of developing diabetes, even acting as a disease accelerator. Tonight, we raise awareness of the growing burden of the disease and strategies to prevent and manage the threat. Joining me in studio is Dr. Daniel Katambo, physician consultant, diabetologist, and director, Kenya Diabetes Management and Information Center. Many thanks for joining us, Dr.
Thank you for having me, Lillian.
Now, there were concerns from doctors at the onset of COVID and even throughout the journey when the world was battling COVID about COVID triggering diabetes. Is this factual?
Well, there is a little bit of fact in it. However, what COVID did to us was that many people got infected with COVID, and especially the people who had the risk factors for developing diabetes. What might actually have happened at that point is that the people who had diabetes or the people who had the risk factors got an acceleration to having the diabetes. According to recent papers that have been published show that the people who developed diabetes at the time of COVID-19 could have anyways developed diabetes in 1 or 2 years' time. So what the COVID did was to sort of like increase the chance of us diagnosing, screening. So when somebody presented to the hospital, in as much as you had the underlying disease, then when you present, you are able to screen and say, oh, you have COVID and you also have diabetes.
So in terms of Kenya as a whole, looking at the rural areas, looking at the urban centers, who is at risk of diabetes and what is the prevalence as we speak?
So currently the prevalence of diabetes is rising at an alarming rate. The prevalence of diabetes right now stands at about between 3.3 to 4%. That converts to about 1.1 million adults in Kenya. This is an alarming rate, and the risk factors, we know them, like, for example, obesity. Overweight and obesity, and of course increased lifestyle, the way we are consuming foods, especially our diets, and we're also becoming very, very sedentary.
And you talked about type 2 diabetes being, the diabetes that a lot of people are actually, getting diagnosed with during our earlier conversation, Terry. Just give us a little bit of insight into this and why.
Yeah, so we have several types of diabetes. Type 1 diabetes is not common, but it is a condition that is chronic, and if it's not well taken care of, it can lead to serious complications. It takes about maybe 1 to 3% of the general population. The larger number of diabetes is usually by type 2 diabetes, which is about 90 to 93%. And then we have gestational diabetes and other forms of diabetes that are caused maybe by drugs or accidents to the pancreas and the rest of the diabetes. But the three most common ones are type 1, type 2, and gestational diabetes. Type 2 diabetes is especially on the alarming increasing numbers, and as I said earlier, this is because of increased reduction in physical activity. Our lifestyle in terms of foods, we are eating more and more, and we are doing much less, and we are gaining more and more weight.
Right, but then we have heard of cases of persons with type 2 diabetes that have actually gone into remission, people who have actually managed the disease and actually tested negative for diabetes. So in terms of management and treatment, what are the options?
So in terms of management of diabetes, now it cuts across again. So when you talk about type 1 diabetes, you involve lifestyle change. And because type 1 diabetes is actually caused by lack of insulin, you totally lack insulin. Remember, diabetes is a condition that results from raised in the amount of sugar in your blood, right? And those could be many factors. One of the factors is what we call type 1 diabetes, where you lack insulin. When you have insulin, you need insulin. When you have glucose, you need insulin to be able to utilize the glucose. But when you lack it, then we have to supplement it externally. That is type 1 diabetes. So on top of lifestyle change, you need insulin.
Right.
In type 2 diabetes, however, you actually have insulin, actually in excess amounts. And in this case, what you need is control of your sugars, that is bringing down your sugars. And when you bring down your sugars, your insulin sensitivity, your insulin hyperinsulinemia goes down. And in many cases now we are seeing studies that are coming out even from the US, the UK, about 70 to 80%. If you have had diabetes for the first 1 year, you're able to put it into remission and you don't use drugs, including insulin.
And we know, Dr. that diet plays a key role in terms of managing diabetes. And this book here is authored by Dr. here, and it's called Kitabu cha Sukari, and a lot of insights here about what we're eating and how dangerous that can be and what the results of that can be in terms of weight gain, as well as, of course, sugar levels rising. Now, Dr. let's talk, very generally about diet and the role it plays in some of this. You say that things such as starches for somebody who is diabetic, things such as oatmeal are actually an accelerator in terms of sugar levels.
Remember what is the cause of, and I want now to focus probably on type 2 diabetes. What causes type 2 diabetes? It's the chronic exposure to sugar that raises your insulin. Remember, you're supposed to produce an almost equivalent amount of insulin when you eat sugar. So when the body detects sugar in your body, it releases insulin. And then the insulin helps you convert that sugar into either energy, where you are running or doing something. And if you're not doing that, then it converts it into fat. So the fat, when you see somebody with excessive weight or kitambi, this is actually sugar. It represents how much sugar they have been consuming. Now, when you look at sugar in itself, by definition, sugar comes from what? Mainly the carbohydrates. And the carbohydrates here are the starch and the fruits, by the way. Never forget the fruits.
Fruits, and so very interestingly, Dr. we'll just take a look at this right here. This is a banana, and Dr. here is talking about the sugar levels in fruits. Now, when you look at this banana, it actually has 17 teaspoons. 17 teaspoons.
Two of them.
2 bananas are equivalent to 17 teaspoons. On the other hand, when you look at pork, is this pork? Yes. Fried pork. Fried pork right here, we're seeing that this has 0. 0 teaspoons of sugar.
So in this case, what the book is trying to illustrate is that, remember I talked about the sugars going up. So what we need to strive to do to manage diabetes is to lower the amount of sugar that we are consuming. But most of the time when somebody develops diabetes, they seek healthcare professional advice, and then they are told to eat fruits, to eat starch, to eat brown porridge, to eat ndoma, to eat sweet potato. So in an attempt to at least demystify that and make sure that we are not consuming excess of that, because you find our parents back at home, that is exactly what they have been told. And yet when they consume those stuff, their sugars goes up. And yet, just to finish up, yet when you look at the amount of meat they eat, they say they have been told to eat 3 pieces of meat. And yet when you look at how much meat raises your sugar, it's not as much. So if you consume healthy meat, healthy fats and vegetables, you're very safe, and then you lower as much as you can the starch and the fruits.
And as we finish, my target range for blood glucose levels in one word, where should that be?
That should be between 4 and 7. If you're not diabetic, if you eat, your sugar should not pass 7.8 after eating.
Your sugar should not pass 7.8 after eating. Thank you so much, Dr. And remember, Kitabu cha Sukari is available at
it is available at my website, afyacode.com.
Okay. So reach out and you will be able to get a guide on how to manage your sugar levels and also how to manage your weight. Many thanks for joining us. We've been talking to Dr. Daniel Katambo. He is a physician consultant and a diabetologist. And remember, November is Diabetes Awareness Month, and we will continue to give more tips on how to manage diabetes in this month of November.